Welcome back to Inside the Owls Burrow. Baptist Health at Boca Raton Hospital is the official sports medicine provider for FAU Athletics. Dr. James Ross is the Owls orthopedic surgeon. I spoke to him about his career and specifically his involvement with FAU football.
All right, game time. Well, I think the sports medicine aspect of orthopedic surgery is very interesting and unique. When I was in my residency program at Washington University in St. Louis, we were exposed to lots of different fields within orthopedics, and I was fortunate to have some very good mentors who took care of professional and collegiate teams, including the St. Louis Blues and the St. Louis Rams. And when I did all those rotations and I worked with the teams, I found it was very unique and very rewarding to be able to take care of these high-level athletes at both the collegiate and professional level. It brings a sense of accomplishment to your work, and I think you're just, even within the community, when people know that you take care of these teams, they look at you with a different aspect as a treating physician.
Baptist Health Boca Raton Hospital is the official sports medicine provider for FAU Athletics. So for you, what does that mean in terms of schedule and what your responsibilities are?
We have our own orthopedic practice, which is open to anyone in the public, and that occupies a good 90% of my time, including clinic in my office, surgeries for patients that need surgery. But we're always on call for the athletes, and of course, we're always taking care of teams. We're constantly coming over to FAU, seeing athletes in the office here, talking with the athletic trainers about injuries that are happening on a day-to-day basis, reviewing MRIs, reviewing treatment plans. So it's pretty much something that you're on call 24/7 for.
When you see a guy like John Mitchell coming back and performing this year after undergoing a major procedure and then a follow-up, to be able to see that and see your work actually help somebody, what kind of feeling does that give you?
Somewhat indescribable. You know, John's an awesome guy. He's an awesome kid. You know, he has aspirations to go into medicine. He's actually come and seen me in the office. He watches surgeries. It's very rare to have a patient, especially an athlete, be very inquisitive about, you know, what does a meniscus tear mean? What does an ACL tear mean? You know, why is surgery done this way? Why is surgery done that way? So that interaction with John this past year it's been interesting, it's unique. But whenever I see an athlete that's able to get back to play, that's the last thing that they're able to accomplish and hurdle over, is that confidence on that body part that got injured and have surgery. So when they get out on the field in a game situation and score a touchdown, just to see how excited they are, you know, there's a sense of excitement that I have to be able to be a part of that, to get them to where they are and where they want to be.
And being a part of this group, you get perks like going on you do all the road trips, you and Dr. Perry. It's great when you don't have anything to do and you can just watch the game, but that's some of the perks of it, right?
Absolutely. I mean, I joke around with my staff sometimes in my office because they can always tell, like, when an away trip's coming up, we seem to get a little bit more excited. You know, it's a nice time to be away from work. Even though you're still working, it's more pleasurable. You know, just to be able to sit back, watch a game. But like you said, whenever there's not an injury, that's the games that we hope for. Is we hate to see the athletes get injured.
As you're the orthopedic surgeon, and Dr. Perry also works with the teams, but there's a whole group of people led by Adam Bennett, who's the head trainer for football, that care for these athletes, and it's not just one person or two people.
I mean, the team that we have is immense. You know, when I tell players, or I even tell my own patients in my office, when I do surgery, you know, that's the easiest part, because it's such a small component to someone's overall recovery and overall health. So Adam, Rudy, the rest of the athletic trainers, I mean, they're on the daily grind, day in, day out, and it's often a thankless job, but you know, they're the ones putting in all the hard effort, keeping these kids healthy, preventing injuries, and then when they do get injured, whether it's a small injury that just needs rehab or an injury that needs surgery, they're the ones that help get them back on the field. Our physical therapists, and more importantly, our strength and conditioning coaches. That's the one thing I found new and unique to our current strength and conditioning coaches, is I've seen an immense drop in the number of season-ending injuries as well as necessary surgeries with our current staff. As you can see, it's a huge network of people that are all putting their heads together in order to make sure we keep the athletes very healthy.
Clearly, the less Dr. Ross has to do, the better, but if the student athletes are injured, they are in more than capable hands. Thanks for watching. I'm Frank Forte. We'll see you next week on Inside the Owls Burrow.
This has been a presentation from Learfield College.